World Health Day is April 7th, and this year the focus is on depression, the largest cause of disability worldwide. And people living with serious mental illness have a life expectancy of 10 to 25 years shorter than the general populations. Joining us now to discuss all of this is Kenneth J. Dudek, president of Fountain House, a program helping people live with mental illness through an integrated approach, and Dr. Shekhar Saxena, director of mental health and substance abuse at the World Health Organization. Welcome to both of you. Dr. Saxena, let me start with you. Do you have numbers on what percentage of the world population suffers from serious depression?
Serious depression is a serious problem, and there are more than 300 million people in the world who suffer from depression. This is between 4 to 5% of the adult population. These are large numbers.
Wow, and on the extreme end of that, it seems that these people are dying sooner than they should be. Are these preventable deaths?
These are certainly preventable deaths. Severe depression, along with other severe mental disorders, people die between 10 to 25 years earlier than other people. And the deaths are not because of suicide. A few of them are, but majority of deaths are because of physical illnesses. They are usually obese, they don't look after their nutrition well, they become hypertensive, they have diabetes, they have cardiac illness, and they die because of that. Because nobody examines them, nobody provides preventative treatment and curative treatment. So this is a gross neglect of people, their health, and leads to death of these people.
And speaking of treatments that work, Ken, that is what you provide at Fountain House. Can you explain the integrative approach there?
So if you have serious mental illness, you basically need three things. You need good medical care, you need good psychiatric care, which usually translates into medication, and then you need a good social service support system, and that's what Fountain House does. Fountain House actually offers all three of these things. And so that's what we refer to as a comprehensive system of care. And the problem is that there aren't enough of these systems in the United States and in the world, and that's what's resulted in some of the problems we face today.
Well, your system of care has proven so successful that it is being repeated in hundreds of countries based on your system.
Yep.
And now currently over 100,000 people are being treated through this type of integrated program?
Yes.
So you now at the World Health Organization have a partnership with Fountain House. Can you explain how that came about and what the goal of that is?
World Health Organization partners with all other organizations which have had the same objective. Mm-hmm. And Fountain House was a very natural choice because it's not only that they're talking about it, they're doing something about it.
Right.
And they are international, they have presence in many countries, and their model has been extremely successful in enhancing the recovery of people with severe mental disorders in all sense of the recovery, including physical recovery.
Right, so important. Now, Dr. Saxena, we've been talking about health here, but let's talk about the cost of mental illness worldwide. What is it costing society?
A huge lot, because of direct medical expenses as well as because of other consequences of people not working, people having absenteeism, even presenteeism, as well as the opportunity cost of these people who could contribute so much to society. And remember that many of these people are young. They are in the most productive phase of their life. One of the estimates is that there is a loss of $1 trillion, this is trillion with a T, in the world because of just depression and anxiety. And if you count all mental disorders, the cost is huge and increasing.
That is staggering. And Ken, there is a new study about to come out from NYU showing how programs like yours, specifically Fountain House's, can help the taxpayer. Can you explain?
So basically, a lot of costs for people with serious mental illness end up being in the hospital cost, which are much more expensive than any form of community programming. And so what we did was a study which basically shows that we are able to reduce the use of hospitals and emergency rooms by 25%. And so the savings are quite extensive then.
That's right, because they then do not go back to
right.
using...
Right. And then also there are other savings as well, which is that it keeps people, a lot of people are ending up in jails nowadays, a lot of people end up homeless on the streets. And so if you have a good comprehensive community system of care, then you prevent those things from happening, and there's all these added costs. I mean, we're looking at very specific costs in a very specific way because it's a research study, but there's a whole bunch of additional costs, the ones that Shekhar was referring to. So there's it.
And Dr. Saxena, when you talk about the focus of World Health Day this year being on depression, there's often a stigma attached to depression. A lot of people don't necessarily consider it, wrongly so, but they don't consider it a disease. So do you find that different cultures and different societies have different belief systems around depression?
Depression is conceptualized as a disorder in very few societies. There is stigma attached, there is lack of understanding. People are unwilling to come forward and accept that they might have depression. Sometimes they just believe that they have some sadness, but it's not a disorder. And the stigma is so severe in almost all communities that it really retards the process of people coming forward for treatment and care, and with terrible consequences. Suicide is one of the major consequences of depression. Right. Depression is, of course, only one of the causes for suicide, but it's a major one. Right. There are 800,000 suicidal deaths every year in the world. This number is larger than all people dying because of conflicts, wars, and natural disasters. It's a huge loss of life.
Absolutely, very upsetting. And Ken, if people want to get a more hands-on and direct view of your work at Fountain House, what can they see this Saturday?
So this Saturday we are having our 1 in 4 5K. The 1 in 4 is the number of people with mental illness in the world. At Riverside Park at 10 o'clock this Saturday. I hope people come out and join us. We're going to walk and run for 3 miles or so.
We had some images of last year's run. That's fantastic.
Great. Yeah.
Ken Dudek and Dr. Saxena, thanks to both of you for being here with us today, and keep up all the good work that you're both doing.
Thank you very much.